Hi, I'm going to show you now how to do the VIP assessment and the IV flush for the OSCE exam. So same approach to your stations as normal. Decontaminate your hands, palm to palm with fingers interlace, back of the hands, fingernails, thumbs, centre of the palm and wrist. Before I approach my patient, I'm going to check the environment is safe to approach. I'm going to ID my patient now, obviously because I'm giving medication. I know on the wards we don't normally class flushing IV as a medication, but this is an exam, so we will be checking that. So picking up my prescription chart, and I'm going now to my patient. So hello Christine, my name's Beth, I'm the nurse looking after you. Is it alright if I just check your details?
Yes, please.
So can I have your full name?
Christine Santos.
And your date of birth?
01/01/2001.
So I'm checking this against my prescription chart and also against my patient's wristband, and I can see here her hospital number is A12345. Alright, so Christine, I'm going to have a look at your cannula in a minute, make sure that's all okay, and I just need to flush it to check it's working. Is that alright?
Yeah, okay.
Okay, fine. I'll be back in a minute. Do you need anything?
Yeah, that's all.
Okay. So now I'm going to go to prepare my items. I've got my trolley. Again, this isn't a sterile procedure, so I'm not going to clean this. So examiner, has this trolley been cleaned recently? And your examiner is going to say, yes, it's been cleaned with soap and water. Okay, I'm going to gel my hands now because I've touched my patient when I ID'd her. If I didn't touch her, then I wouldn't need to gel my hands. Now, as with your other medications, I'm going to carry out a quick prescription check. So I can see here the patient's name, date of birth, hospital number I've checked. Allergies, actually I forgot to check that, but I'll check it on the way back. And I can see here she's prescribed sodium chloride, and that's 5 ml flush, and that's signed by Dr. Jones. So I'm happy to use that because I know 5 ml is an appropriate amount for a flush. Just when I go back to the patient, I will check her allergies. So now I'm going to assemble my items. So here I've got my IV tray. This has been cleaned with soap and water in the last 24 hours. You can give it a wipe down if you want to, but the examiner will tell you it's clean. I've also got my IV flush, which will be in a pre-filled syringe of saline. So unfortunately in this hospital we don't provide these in a pre-filled syringe, so I've just drawn it up myself. So it will be in a packet, so we need to check it's clean, intact, the expiry date, and we will check the medication. So I've got sodium chloride IV, and here I've got sodium chloride 0.9%, and it expires 2025. So I'm happy to use that, and I've got 10 ml here, but I need to give 5 ml, so I've drawn 5 ml up in my syringe already. If you have a batch number on your chart, you can record that now, or you can do it after you've given the medication. I'm going to do it now because I find it easier. But don't worry, you can do that afterwards. You've got 8 minutes for this station, so plenty of time. So now I've got my medication. I'm going to decontaminate my hands again and pop on my glove and apron. So going back to my patient's bedside, before I give the medication, I need to check her cannula site. So we believe in the exam they're going to provide you with a photo to have a look at. So I've made a few examples for you. So using this one, we can see the cannula's healthy, the skin is still pink, there's no redness or swelling or anything, so I'm absolutely happy to use this. Okay. You will be provided with this VIP scoring chart in the exam, which is on the webpage for this station, so you can have a look at it. Obviously, a score of 0 is your healthy cannula, going right down to 5 of advanced phlebitis, which we wouldn't want to use that cannula in that instance. Okay, so I'm assuming they're going to give you a cannula that's okay to use, otherwise there's not much point in continuing with the station. So as with all my medications, before I give it, I'm going to perform a second ID check. So is it okay if I just check your details, please?
Yes.
So can I have your full name?
Christine Santos
And your date of birth?
is 01/01/2001.
And hospital number here I can see is A123456. Again, I'm checking this against my drug chart and my patient's name band, and it is always best practice if you have a patient who can speak to ask them their name and date of birth. Are you allergic to anything, Christine?
Sorry?
Are you allergic to anything?
No.
Okay, that's fine. So I'm just going to check your cannula's working. I'm just going to give it a flush. Other thing that I would need that I've forgotten to get is a small alcohol wipe, so I'll just get that. Okay, so here I've got a small Sunny Cloth wipe, which is 2% alcohol, and again checking it's clean, intact, and it expires 2022. So I'm going to clean the site of the cannula. So this is a common cannula we have here in the UK. So I'm just going to have a look at this now, Christine. It won't be painful or anything. So I'm removing the top here and cleaning this port for 30 seconds. 1, 2, 3, 4. And your examiner is going to tell you 30 seconds is up. And I'm going to let it dry now for another 30 seconds. So 1, 2, 3, 4. And again, they're going to tell you 30 seconds is up. We can also use this other port on the end, the white one, but that's more for like connecting IV fluids or something like that. So I've already checked my prescription, so I'm happy to go. So attaching my syringe, obviously I've checked there's no air bubbles, and just flushing it as you would normally in a pulsing manner. Okay, so I'm all done with that. Okay, Christine, I'm all done now. Do you need me to do anything else?
No, thank you very much.
So as before, I'm going to dispose of my items in the yellow clinical waste bin. I would wash my IV tray before I use it with the next patient. Take off my apron first, then my gloves. Decontaminate my hands. And finally, I'm going to complete my drug chart. So here, I need to put candidate's name, so that would be my name. And then here on the end, I need to sign, put the date, and the time. And I would double check your batch number, that you've completed that. If you haven't done it now, you could go back and do that quickly. And that's it.